challenges we see in aphasia therapy. But instead of just cueing or giving the patient the word, what if we could help patients build their way back to it using the language system itself? Today, we're breaking down Semantic Feature Analysis, or SFA for short. This is one of the most widely used approaches for naming in aphasia therapy. So what is SFA? SFA is a structured word finding treatment designed to improve lexical retrieval by activating semantic networks. Instead of focusing only on the target word, we guide the patient to generate meaningful features related to the item. So, if the target is apple, we don't just ask for the word, we explore it. What category does it belong to? What does it look like? Where do you find it? What do you use it for? And what does it remind you of? The idea is simple. The more semantic information we activate, the stronger the pathway becomes for the target word. What's the theoretical basis behind SFA? SFA is based on models of lexical retrieval that describe language as highly interconnected semantic networks. In this framework, a concept is not just a single stored label, it's a cluster of semantic features that together define meaning. Let's take the concept of fruit. It includes features like edible, contains seeds, grows on plants, and importantly, these features are shared. So one feature like grows on trees can connect apples, oranges, lemons, and more. So instead of a dictionary in the brain, we're really looking at a web of overlapping meanings and connections. When someone names a picture, activation spreads through that network from visual input to semantic features and then to related concepts. That activation then flows to the word level, and the item with the strongest activation is selected for speech. From there, the sound structure is retrieved and the motor plan for speech is executed. So why does this matter? Well, clinically, what this tells us is simple. If we strengthen the semantic network, we improve access to the word itself. Let's walk through what this looks like in therapy. Say the target word is hammer. We might ask, what category is it? What does it look like? What is it used for? Where would you find it? What else is it related to? Even if the patient can't retrieve the word immediately, they're still actively building the semantic network around it. And often, that structured activation is what leads to successful retrieval. So, who is this therapy approach for? SFA is commonly used for individuals with anomia across a range of aphasia profiles. It tends to work best when comprehension is relatively intact, patients can engage with guided questioning, and there is capacity for self-cueing. Okay, so here are a few clinical tips that you can use when implementing SFA. It's really important to give patients time to generate the responses. Don't rush to supply the word too early, and use written or visual supports when needed. And focus on participation, not perfection. The goal is not rote learning here, it's rebuilding access to meaning. That's your introduction to semantic feature analysis. In the next episode, we'll move into verb network strengthening treatment and explore how verbs can expand sentence-level language far beyond single word retrieval. Thanks for watching, everyone. This is the Aphasia Treatment Series, and I'll see you in the next one.